Hi, I'm Juliette Murray, Deputy Medical Director and a Consultant Breast Surgeon at NHS Forth Valley in Central Scotland.
And I'm Nasser Tarabi, Director of Evidence and Implementation at Cancer Research UK. Today we're discussing test evidence transition, a research programme to test innovative approaches to better diagnose cancer and then speed up the translation of these innovations across health systems. And thanks to Royal London's incredible support, we're funding NHS teams and researchers to do this. We launched phase 1 of TET in 2023, supporting 3 NHS teams who are collaborating with universities on breast cancer and prostate cancer pathways in Scotland and Wales. And one of these teams is led by Juliette. Can you tell us more about your project?
Absolutely. So what we did was set up a direct access pathway to the one-stop breast clinic for patients with a breast lump, meaning that they didn't have to have a consultation in primary care with either a GP or ANP before coming to the clinic. They could phone the receptionist, say they had a breast lump and come directly to the one-stop. We hoped that by doing that, we would accelerate the referral process and allow patients to be seen sooner at the clinic, thankfully for most people being reassured that they didn't have cancer, but for those ladies that did have cancer, getting them onto a diagnostic pathway and treatment pathway faster. We hoped that by implementing the pathway, we would increase GP capacity, we would help prevent delays in diagnosis and improve the patient experience and outcomes. We worked really closely with Stirling University on the evaluation of the project so that we had data to look at both the expected and the unforeseen consequences, but also to capture how to implement it so that we could help with the spread of this type of project to other areas.
And what stage is the project currently at?
So the project's now complete, as is the evaluation, and we've just finished completing the final report. The direct access clinics are fully established on a permanent basis and are now business as usual for us.
Brilliant. What's the impact of the clinic so far?
So we've seen more than 1,000 patients now in our direct access clinic, and the data has shown that patients attended the clinic quicker and the overall cost to the NHS is lower with this new pathway. We know that the process is effective and acceptable, so we've got more than 50 GP practices in Forth Valley and all of them have got this pathway in place, and it was relatively straightforward to do that and get that set up. We know from our qualitative data that patients trusted the process and they thought it made sense to come directly to clinic. They appreciated not having to take 2 afternoons off work to go to their GP and then to come to the clinic. For many patients that meant a loss of income. But we also know that it was universally popular with GP reception staff, with our primary care and secondary care colleagues, and we were able to reassure people that it didn't lead to an increase in referral numbers and that it was win-win for everybody.
That sounds like fantastic progress. So how do you plan to spread this innovation to other patients who need it?
So what we've done is we've used our own networks in terms of chatting to colleagues in the other breast units, and we've had 3 or 4 of the other health boards in Scotland already expressing an interest in starting to implement that and asking our staff how to do that and sharing resource. We've also taken every opportunity to present the data at conferences, to publish it, and we will continue to do that over the next year, both locally in Scotland but also in England and Wales and further afield, hopefully, as we get interest in this. It has been relatively straightforward and simple to do and to keep going on an ongoing basis without additional resource, which is very reassuring.
Wow, and we're really looking forward to supporting you on the next steps of the journey.
Fantastic. I know that along with our project there are 2 other phase 1 projects. Can you tell us a bit more about these, Nasser?
Yeah, so we've got a project in NHS Fife in Scotland, which is a nurse-led pathway for urology. So it's a one-stop service, initial consultation and a range of tests in a single visit. Also with a care navigator who helps patients do things like book transport. The other project is in Wales. It's called Prostad at Haraldar University Health Board, and they're working with Swansea University to test a new pathway for diagnosing prostate cancer with MRI scans, avoiding unnecessary painful biopsies. And both projects are doing really well and are at the stage of finalising their evaluation reports. And both have won awards. So the Welsh project has won an NHS Wales Efficient Care Award, and the NHS Fife project has won a Chairs Award from their organisation. They're doing really, really well.
That's fantastic, and all projects seem to have been successful and delivered what they'd hoped to, which is great.
Yeah, and so the Test Evidence Transition Programme is really helping us to reduce inequalities and bringing us closer to a world where everybody lives longer, better lives, free from the fear of cancer. So thank you to Royal London for their support. And together we're beating cancer.